Welcome everyone, and thank you for attending today's HIMSS Industry Solutions webinar, Disinfection Protocols for Healthcare IT Equipment, Help Reduce HAIs and Safeguard Patients, sponsored by HP. My name is Mike Milliard. I'm editor of Healthcare IT News, and I will be your moderator today. During this presentation, infection prevention experts working on behalf of the Association for Professionals in Infection Control and Epidemiology Consulting Services will discuss the risk that contaminated IT devices can pose in the transmission of healthcare-associated infections. We'll also review cleaning and disinfection protocols that have been created by APIC Consulting Services for HP. Our speakers for today's presentation are JOAN HEBDEN and SCHWEON, Infection Prevention Consultants, Richard VOGEL, Infection Control Specialist at New York Presbyterian, and MELINDA Schmidt, Senior Healthcare Specialist at HP. And so with that, I'll hand it over to JOAN to begin the presentation.
Good afternoon, everyone. I'm really happy to have you on the call today to talk about what is becoming a pressing issue for us in infection prevention. Innovation in mobile communication technology has provided novel approaches to the delivery of healthcare and improvements in the speed and quality of routine medical communication. However, along with those benefits comes the potential for bacterial contamination of these devices, as we know that they are going to be frequently reused. They may be in areas where there is high patient volume and a large number of healthcare providers utilizing these devices. What we'd like to share with you today is some of the information about the contamination of these devices and why it is important that the disinfection, along with cleaning, if there is visible soilage, is an important component of environmental hygiene for your infection prevention program. We will be talking about the distinction between cleaning and disinfecting of reusable patient care equipment, specifically electronic devices, for this webinar. In addition, we are going to share a recommended protocol for cleaning and disinfection of these devices, along with some of the agents that are typically used for cleaning and disinfection. And we will also share some recommendations regarding frequency and disinfection of these devices. I'd like to then ask my colleague to speak, Steve and Melinda. Thank you.
This is Steve. I want to talk to you about electronic devices as being a potential source of pathogen transmission. As you probably already know, pathogens are microorganisms such as bacteria that can cause infection. Computers, displays, mice, and keyboards are frequently used at the point of care and in common areas where patient care is delivered. We know there is a high risk of contamination with pathogenic bacteria from the hands of healthcare providers or from the environment. For instance, MRSA infections in patients were directly linked to computers in an ICU. In a study of 25 keyboards, all tested positive for growth of at least 2 or more microorganisms. This includes coagulase-negative staph, diphtheroids, and micrococcus species, which are skin bacteria, as well as ORSA, which stands for oxacillin-resistant Staphylococcus aureus. Now, you probably are familiar with the more common term of ORSA or MRSA, MRSA, or methicillin-resistant Staphylococcus aureus. And 17 hospital touchscreens were cultured, and they recovered the following pathogens: C. difficile, which we know is responsible for horrible diarrhea; VRE, which stands for vancomycin-resistant enterococci, a gram and antibiotic-resistant organism, as well as Klebsiella. Melinda, I believe you're up next.
Yes, thank you, Stephen. So a while back, I was working in PACU, and I transferred my patient up to the med-surg floor, and when I came back, there was a surgeon on my computer, and he was wearing gloves. When I pointed out the gloves to him, he said they were clean, got on his phone, and walked out. So I wasn't 100% confident that they were clean, so I went and grabbed the super Sandy-Cloth wipes and disinfected the entire area, starting with a computer, keyboard, and mouse, and working around that area. because I really didn't know what he touched. From that point, I always made it my mission to disinfect my notebook, keyboards, and mouse at least once a shift when I came on to make sure it was all safe for my patient. This will lead us to our first polling question. Are computers, for instance, notebooks, laptops, all-in-one PCs, keyboards, and displays used for patient care regularly cleaned and disinfected at your hospital or clinic? So if you can respond yes or no, we would like to get that feedback. That's what we thought. Okay, now turning it over to Rich. Thank you for your responses.
So as you can see, quite a few of you have put no as your response. That's kind of what we expected. We now have some general recommendations for cleaning and disinfecting devices. First thing you want to do is be sure to turn off the device you are going to clean and disinfect. The liquids actually could damage the device if they got inside. The next, you want to make sure your hands or gloves are clean, so you don't want to transfer any bacteria or viruses back onto the devices. You want to make sure the germicidal wipe you're using has been approved by the manufacturer. Using a germicidal wipe that is not approved could damage the device since they haven't been tested on those particular computers, mice, and keyboards. Germicidal wipes should be used rather than a spray. Using a spray could result in applying an insufficient amount of the germicide, as the quantity that you're applying is really hard to determine when you're just spraying something on a surface. Likewise, there's a potential for the aerosolization of the disinfectant to be traveling into adjacent areas where it may have an adverse effect even with people breathing. We recommend that you use a microfiber cloth that will prevent damage and scratching of the displays. When you are cleaning and disinfecting the devices, it's good practice to start at the top of the device, whether that be the laptop or the display, work your way down, then cleaning the mouse and the keyboard and finishing up with the cables. Joan, you want to take the next one?
Yes. We have another polling question for you. Does your facility address electronic device cleaning, disinfecting in your management of reusable patient care equipment policy and procedure? Please respond, and then we'll reveal the results. Okay, thank you very much. That is pretty much what we would have expected. There has been some concerns about the fact that these devices, which have gained a lot of visibility in healthcare settings, may not be included in your reusable patient care equipment policies and procedures, and I see that 36% of you have indicated that there is not any inclusion of the devices. So let's go ahead and talk about why it's important for these devices to be cleaned if they're visibly soiled, and then we're going to talk a bit about disinfection. Because these devices have the potential risk for serving as reservoirs for potentially pathogenic bacteria, it is going to be important that you consider cleaning and disinfection of these devices. And this should be considered on not only a routine basis, but also on a somewhat immediate basis by the user. If there is, in fact, visible soiling of the device, you happen to be using the device, and there should be a spill of a patient body fluid, for example, or you're in a situation where there is a liquid that was sitting near the device that happens to soil the screen, it is going to be important that you remove any visible dirt or biologic debris prior to disinfection. And this particular list of recommendations points out that you're going to want to perform hand hygiene and don clean gloves before you do remove whatever is soiled the device or accessory. And this can be done with a water-dampened cloth, which is the recommendation of some manufacturers. We do recommend, however, that the cloth that's used be one that is microfiber. And the microfiber is important from the perspective that cotton types of cloth may actually serve as a binder for the detergent or the disinfectant that you might be using. So it is important to think about the type of cloth that is going to be grabbed for this purpose. And certainly you also want it to be a static-free cloth that doesn't have oils. And you don't want anything such as a paper towel, for example, that may actually scratch the device. The cleaning agents that are generally used in healthcare, we will be discussing in a few moments. However, I did want to point out again that in some of the manufacturers actually are simply recommending that the sole be removed with just a water-dampened cloth. Then you can proceed, after you've allowed the device to air dry, to the use of a manufacturer-approved germicidal product for disinfection. Now, we refer to these as one step because many of the disinfection agents that are on the market are going to also have cleaning properties. However, even before they are used, it is important to get rid of any visible dirt or biologic debris. Now, all of you are aware that disinfection refers to an elimination of most, if not all, pathogenic microbes. And so this can be accomplished through the use of a disinfectant chemical, and we are going to go over those types of agents in a bit. But I did want to start out by saying that it is critically important for you to know the germicidal wipes that are being recommended by the manufacturer of your devices, your electronic devices. And these products that are going to be recommended by the manufacturer are generally included in the instructions for use. And they also should be viewed from the perspective of appropriate application and contact time of the product. And that may not be something that will be in the device manufacturer's recommendations, but certainly it is going to be prudent and required by your team of individuals who have come together to write out these recommendations, to know which products are being used, and to know the product manufacturer's instructions as it relates to application and contact time. The performance of hand hygiene and the wearing of gloves is certainly recommended before you do your one-step disinfection. You need to expose all of the surfaces of the device, which would include your accessories, to the disinfectant. And it is important to ensure that your germicidal wipe remains wet during the application process and that you replace if necessary. You are sure aware that this is something that is viewed by surveyors when they walk around on your clinical units to determine that you do have the top of your germicidal wipe containers closed. If you do have those tops open, the wipes can get dry. So ensure that you've chosen one that is saturated with the germicide. Again, you want to ensure that the contact time that's been specified by the germicidal wipe manufacturer is adhered to. We're going to talk a bit about contact times in just a few moments. Allow the device to air dry, remove your gloves, and perform hand hygiene. One caveat about the type of germicidal agent is that if you do suspect that the electronic devices have been contaminated with Clostridium difficile, which, as you know, is a spore former, or norovirus, which is a non-enveloped virus that is very sturdy and resistant to disinfectants, that you want to use a sporicidal agent such as hypochlorite or bleach to disinfect those devices. Okay, we do have another polling question. Which department in your facility is responsible for the routine cleaning and disinfection of PCs, keyboards, and displays? And I would point out that there is an all of the above option there in the event that that would be relevant. Okay, we have a bit of a across the board responsibility here, and my guess would be, I see almost 30% of you are saying all of the above. The responsibility, again, should lie with, for routine cleaning and disinfection, a specific department. So EVS obviously is going to be doing routine disinfection of your environment in general. And whether they include the electronic devices or not should, of course, be specified in your EVS documents, and then obviously they need to be appropriately trained. I do see 14% saying IT, which is a bit surprising because generally the information technology folks want someone to disinfect the device before they come and fix it for us if it's in a clinical area, but generally they don't have responsibility. Nursing, of course, is going to have responsibility for those devices that are on the clinical unit, specifically in nursing stations, and in the patient rooms, particularly if there is concern about the harming of the equipment. I am aware that there are some clinical settings where nursing may take that routine responsibility. Okay, and I'm going to turn it over to Steve to discuss frequency and responsibility.
Oh, thank you, Joan. Frequency and responsibility, just to let you know that this direction was developed using best practices and expert opinion due to the lack of scientific studies. Routine cleaning and disinfection should, at a minimum, be performed daily. Once per shift is recommended for clinical areas where patient acuity and volume or volume is high, or devices will be handled by multiple staff. For mobile workstations, cleaning and disinfection should be performed between each patient use. Facility policies, for example, nursing or information technology, environmental services, etc., should be referenced as needed for additional cleaning and disinfection guidance. If the electronic devices become visibly soiled or contaminated with blood or other bodily fluids, it is the responsibility of the user of the device to perform immediate cleaning. After the cleaning is performed, the next step obviously would be disinfection. Remember, these are recommendations or best practices, not professional guidelines. Rich, I believe you're up next.
Okay, so we have here a table of some commonly used cleaners and disinfectants. The products listed here have been tested for compatibility with HP products. There are two cleaners here that contain alcohol and are listed at the top. Often alcohol can be considered a disinfectant, but these two products do not contain enough alcohol in order to be a EPA-approved disinfectant. There are four categories of disinfectants listed here. There's aquat alcohol, a bleach, a hypochlorite, and the hydrogen peroxide. The bleach and the hydrogen peroxide, as we discussed before, would be used for C. diff. Although there are other formulas and other disinfectants, it would be extremely difficult for a manufacturer to test the products against all or even a significant percentage of the available disinfectants, which is why it's important for you to check with the manufacturer to make sure the disinfectant you're using is approved. Perhaps the most important information on this chart is the contact or wet time. And as you can see, they vary from 10 minutes to 1 minute. The surfaces being disinfected must remain wet for the entire time listed. Very often, this may require the use of more than one cloth in order to make sure that there's enough product on the surfaces of the devices to keep them wet for the entire contact time. At this point, we will take some questions from the audience. Mike, you want to take over?
Absolutely. Yeah, we already have a couple questions from the audience, and we do encourage you to please submit your own by just typing them in the questions box and hitting submit, and we'll get to as many as we can in the next few minutes. First up, someone's wondering, is cleaning in instances of visible soiling in addition to the agreed frequency of cleaning? And they were also wondering whether you keep a cleaning log. And any or all of you can jump in on that.
Yeah, this is Joan. The concept of cleaning, as I mentioned earlier, is one where, you know, everyone is aware you can't really disinfect something that is visibly soiled with dirt or other types of debris. So in the event that there is visible soilage, you do need to use something to remove that debris. The disinfecting agents that we have shared with you that are on the table are also cleaning agents as well. That's why they're called one-step. So in the absence of visible soiling, you can skip the cleaning step as a separate step and just simply use one of the disinfectants that also has cleaning properties. And the ones that we have mentioned here are, with the exception of bleach, they're generally going to be adequate. In terms of your other question, can you repeat that, Mike? I'm sorry. I think there was a second part to that.
I believe they were asking whether there's a cleaning log.
Okay, a cleaning log. I have to say that logs are nice, but whether or not they're actually going to be used and kept up is questionable. I've seen logs placed on the side of ice machines, for example, which are, you know, another sort of device that's out there that may kind of get lost in the shuffle of thinking about things that need to be cleaned and disinfected. I do think there needs to be some observation that the cleaning and disinfecting is being done. I would suggest that that be included on an environmental hygiene checklist, for example, and by simply making environmental rounds, observing what is going on when a room is being cleaned, for example, that may have a computer in it. In addition, I think it would be pretty obvious if things are not being cleaned, for example, at a nursing station, where you may actually see dirty keyboards, dust on the cables, that kind of thing. So observation, I think, is more important than having people sign a log.
Gotcha. Makes sense. Someone else is wondering whether germicidal wipes deteriorate certain protective casings that are meant to protect or privatize devices. And are there germicidal wipes that don't have that effect over time?
This is Steve. I can try to address that. I would check with the manufacturer of the device and see what products they are recommending. That would be the first place to start to ensure that their products are effective with, let me rephrase that. You want to use products that are only recommended by the manufacturer for cleaning and disinfecting their digital, their electronic device. I think if you use products that are not recommended, you risk that chance of additional damage to the electronic device. So take-home message is check with the manufacturer and use the manufacturer recommended products on your electronic device.
Okay. Someone else is wondering what cleaning or disinfecting products might HP recommend for laptop computers used in patient care?
I'll take that one. This is Melinda. HP has the 2018 Healthcare Edition portfolio, and on the screen previous to the, can we go back to the earlier screen, the previous screen? On this screen, all of these have been tested on our 2018 Healthcare Edition portfolio and can be used on the notebook, the all-in-one, and the clinical review display, specific for healthcare.
Okay.
So these are not approved. The disinfecting wipes for other manufacturers I cannot address, but for the all-in-one, for the Healthcare Edition, these are approved.
Gotcha. Someone else asks, will I need to clean the bottom of the keyboard and the mouse also?
I'll take that one. It's Rich. Absolutely. It's the same as cleaning any other surface that you might come in contact with. People touch the bottom of the mouse, they move the keyboard, and they touch the bottom of the keyboard. So everything, top and bottom, has to be cleaned.
Okay. And someone else is wondering, we have some issues with disinfecting agents causing laptop keyboards and screens to stop functioning. Any recommendations or alternatives to help avoid that?
That means they were not approved for that from that manufacturer. So they were not able to be used on that equipment.
Okay. It's an important point to
Yeah,
attention to.
you know,
Very caustic agent, so a lot of IT equipment doesn't do well with germicidal wipes.
It also may be that they weren't turned off.
True.
Oh, good point. All right, one last question here before we wrap up. Someone's wondering, how can we monitor for compliance?
Yeah, this is Joan. I had spoken to that a little bit with the earlier question. I think that it is important for there to be included on an environmental hygiene checklist the monitoring of cleaning of reusable patient care devices. And the process that's generally being used these days is the use of a fluorescent marker and or ATP monitoring, which is a method for monitoring the amount of residue that exists on a surface. I would suggest that this type of equipment be considered, as I mentioned earlier, in any policy and procedure speaking to reusable patient care equipment. And right now, most infection prevention programs are doing more than just observation to ensure that they are getting the protocols followed through on for the cleaning and disinfection of reusable patient care devices. And so there would be no reason why these devices could not have whatever type of monitoring is being done for other types of equipment. They could also have that type of monitoring performed. Sometimes that is done through the Environmental Services Department. Other times it is done through a quality infection prevention type initiative. I've known some nursing staff that have wanted to get engaged in it and follow through on doing education and mentoring of people about the importance of removing these potentially pathogenic bacteria from equipment that is frequently touched by healthcare providers. I don't know if my other colleagues have anything to add to that.
No, that sounds like you got it all.
All right. Well, we are just about at 2:30. We will try, I think, to answer any questions that we were not able to get to following the events in a follow-up. But at this time, we do have to wrap up. So thanks again to our speakers for a very terrific and informative presentation. And thanks, of course, to the audience for joining us. Please be sure to complete the evaluation at the conclusion of today's event and share your thoughts with us. And just a reminder that today's session will soon be available on demand through the HIMSS Learning Center. Have a great day, everyone, and thanks again.